Let's take a listen to individuals who have spasmodic dysphonia diagnosed by UCLA Medical Center and the voice that they diagnosed as spasmodic dysphonia with Gail Pace.
A round of antibiotics, and then they put me on a stronger antibiotic, and I took that, and I began to feel good, but the voice has been a mess ever since.
When was the flu? How many months ago?
It was in March, the end of March. Oh, and I did go to a speech therapist for a while. But that didn't, some days I'd go in there and I was fine, just like I am all the time. I couldn't tell that it did anything at all.
Now we're about to listen to the cured voice of Gail Pace. Let's take a listen.
At that point, I was so depressed that I wondered about everything. I didn't want to. I'd had people really say mean things to me. Mm-hmm. I had worked most all the time, and people are unkind a lot.
Especially if you don't have your voice.
Right. And so I had become rather withdrawn, actually. Mm-hmm. And that's not exactly normal. In fact, there's a list, very, very long, of all the different medications that they gave me, mm-hmm. and different things that we tried. I went to a speech therapist. I even took prednisone, which mm-hmm. I was afraid of, but it really didn't do any good in the long run either. The first day or two, it did help, mm-hmm. but after that, it didn't seem to help either. Some days, whatever I was taking, it was a little bit better. Mm-hmm. And then I'd think, oh, Lord, thank you, we're finished. The next day I'd get up and it would be gone again. And then finally I saw Dr. Larry Pleat in Encino, mm-hmm. I believe is where his mm-hmm. office is. And he gave me 3 different choices. He thought it was either spastic dysphonia, an allergy situation, which I did have allergy testing, by the way, or carcinoma of the vocal cords, which scared me a lot. In fact, the allergist that I had gone to didn't know what was causing this either, and he had called Dr. Burke at UCLA and made an appointment for me. Mm-hmm. And so I did go ahead and go to see him, and the same day saw Dr. Bruce Garrett, mm-hmm. And they did some testing, cameras down my throat and such as that. Mm-hmm. was pretty yucky, really. And then when I came back, they said that it was spastic dysphonia. And then, when Dr. Garrett did the last test, mm-hmm. When I went back.
We sent you back. Uh-huh. We had a before examination when she couldn't talk, and UCLA Medical Center checked her, confirmed spasmodic dysphonia, and then she went back. I sent her back, and
when he put the tube down my
mm-hmm.
throat, it messed it up, mm-hmm. and it took me a while to get it back mm-hmm. where I could talk.
They say you're normal now.
Mm-hmm.
Gail Pace has remained cured for 14 years. It was kind of Gerald Burke to afford me the opportunity to work with Gail Pace, and of course I'm indebted to him and to the medical center, as you will hear, because I've worked with over 15 of their spasmodic dysphonic cases over a period of years, and I have cures of these cases, documented cures, as you will hear. Let's take a listen to Gail Pace.
I had lined myself up to agree to the Botox injections if mm-hmm. they felt like that was, mm-hmm. Because it didn't seem to have any long-term effect.
Nobody knows. Nobody knows what the long-term
well, so any of the things that I read.
The fact is, that scares me.
Well, it scared me too. But
you didn't go for the Botox?
No. They injected me with something the second time mm-hmm. I was there mm-hmm. that was supposed to act a lot like the Botox, that was supposed to tell whether or not the Botox would work. Mm-hmm. And they decided that yes, it would, because immediately it cleared my voice out. But they also decided to have me try coming to you first. Mm-hmm. And so that's much easier.
You went to a speech therapist.
Yes.
What did she tell you to do?
Well, she had me do breathing exercises, and she had me do H words, and she had me do E sounds, and she's a very nice lady.
The people in my field are very nice, and they're very well intentioned, and I respect them greatly. I just would like them to understand there's a difference in approach of what I'm doing, what they're doing, and success can be theirs by doing what I'm doing. That's what I would like them to understand.
Some days when I was there, it would be very good, and then but I could not come up with a cause and effect. I mean, something that would make it better if it was bad.
It wouldn't carry over.
No.
So you couldn't use it on the outside.
No, not at all. I mean, it would seem to be quite good in there, and then it was like it just didn't work.
We are trying to explain that what I do is a program called Direct Voice Rehabilitation, and I remain the only doctor in the world reporting ongoing cures or cures of this condition by direct voice rehabilitation. Gail Pace is now going to add on, so we get a tail end of her story. Let's roll that tape, please.
How did you get into it? Was it a cold or some...
I had the flu and developed laryngitis, and that's what it seemed like. And then my voice didn't come back. When I got better, the voice didn't get better.
You kept using that lower throat sound and forcing it.
I couldn't get it. It didn't come back. Didn't I decide there were 9 different doctors?
You went to speech therapists?
Yes, we tried that. I took a list of medication a mile long and tried everything under the sun that anyone's home remedy that might even work. And some things would for a little while. The prednisone was great. I see why athletes get hooked on that stuff. But
what does it do? It gives you an upper?
It's a high. And it did. The first day, 2 days that I took it, I could see a marked improvement. But then immediately it was gone again. It didn't last, and nothing did.
You had abductor and adductor, the worst type of condition, confirmed by UCLA Medical Center.
Right.
You declined Botox or the poison.
Actually, they had not decided to try that. They gave me an injection of something that
Xylocaine.
Worked something like that, and it did work immediately, and my voice went from that sound, and it was clear. But it wore off within an hour and a half or 2 hours. But they decided to send me to you.
You didn't want to have?
No, I had
poison.
already researched the different things that were available for the condition, and did not want that. No, because it very definitely said it was poison.
You didn't want surgery?
Oh no, I did not intend to have surgery. Everything I had read about that also was not good. Very little was to be said about that was good. It just, and I had already decided we weren't going to play that game.
It was a pleasure to work with Gail Pace and to help her to get her voice back. She went on national television to talk about her cure on a national TV program. Spasmodic dysphonia is curable. Gail Pace is just one of many whom I've helped to cure. There are a number of patients diagnosed at UCLA Medical Center in the Head and Neck Division by their staff, ear, nose, and throat doctors, and by the faculty. Let's take a listen to Marjorie Whitman, who was diagnosed by Dr. Paul Ward, the former chairman of the Head and Neck Division before Dr. Gerald Burke.
Because I've gotten I said to my neurologist, can you get a brain injury through a psychosomatic condition, which I still thought I had. That's why I've gone to so many psychologists. But he said, no, he feels because I have the brain injury, some kind of clotting or something has had to have happened that causes damage in the brain.
Marjorie Whitman could not get one clear sound out. Paul Ward was of the view it was a hopeless condition and was of the mind that it might require surgery. I was privileged to work with Marjorie Whitman. Let's take a listen to further narration by Marjorie.
And then I'd go in and start talking to my boss, and at the end of like a sentence, it would start dropping. And he'd say, what's wrong with your voice? And I'd say, I don't know. But I knew, I had a feeling that from what I had been going through the day before, what I had implanted in my brain had something to do with my speech.
But they say your problem is neurological.
Yeah, and so, but with time it kept getting worse and worse. With time, and then it would happen more through the day. As the months went on, it kept happening more and more and more, and then it got where it was so bad, I could hardly speak at all. And when I go to open my mouth to speak, I had so much pain. And then finally, I started going to a series of 11, 12 different doctors, and it got so bad I thought it was an emotional problem. So I was going to psychiatrists' offices, hypnotherapy, different ear, nose, and throat doctors, and it was just a big gamut of a lot of different doctors. And I was in so much pain at this time, which was a year later from the onset, that I went to an acupuncturist to get rid of a lot of the pain.
You were diagnosed at UCLA Medical Center
Yes.
having spastic dysphonia.
Yes.
They
Yes.
suggested surgery.
Yes.
You declined.
I didn't want to have that done.
Marjorie Whitman was a very cooperative patient, and that is what it takes to overcome and find a cure of spasmodic dysphonia. Let's listen to her ongoing story.
Because I couldn't speak at all, and because I was using all the wrong muscles and everything, I had pain from the top of my head to the middle of my back.
Mm-hmm.
I mean, that's where I had pain.
And
It was very severe.
is that pain gone?
Yes. Because once I've opened up the breathing, it's taken all the pressure off the neck and the shoulders and everything. And so now I don't have, once in a while I get a little ache, but it's not anything like I had before. And with spastic dysphonia, it does not come back that easily. It's been a miracle, because I couldn't speak at all. And I think it's truly a miracle that I'm speaking. I can get on the phone and talk to my friends and order food in a restaurant and just do all these simple little things that it takes a voice to do. And it's marvelous just to be able to do that. I mean, at one time you think, I'm never going to be able to speak again. But once things start breaking loose, like the breathing, when I was getting this and getting the humming back, I thought, I just know the voice is now going to come back once I got through those two hurdles.
The medical field, in part, responds to cures of spasmodic dysphonia, saying the cures I have of spasmodic dysphonia are not spasmodic dysphonic conditions. This is not true. And they continue to disbelieve, to deny cures of spasmodic dysphonia in the face of ongoing cures of spasmodic dysphonia by DVR, which is all natural. The question then comes down to, are the cases I'm presenting to you, and I have a whole list of them, at least 15 spasmodic dysphonic cases diagnosed at UCLA Medical Center alone. And on my website, I list the names of the doctors so that you are aware that you have some of the finest ear, nose, and throat doctors in the world diagnosing spasmodic dysphonia. There's no question about the patients I'm treating having spasmodic dysphonia. I have them on a video, I have them on audio, and I continue to add to that list ongoingly. Thank you very much for watching what might seem to you to be an unusual condition, but those who have spasmodic dysphonia, and there are millions of them in the world, many go undiagnosed and others are told there are no cures. In the face of ongoing cures of spasmodic dysphonia by all natural DVR, I work in tandem with my medical colleagues and have done so when I was on the staff and faculty at UCLA Medical Center as a clinical assistant professor, and I ran the voice and speech clinic for UCLA. Thank you very much for joining with me. I'm Mort Cooper.